Good morning, Illini. Welcome to another Healthy Illini podcast. I'm Matt Schrock, your host, and we are full swing into the fall semester, which means finals, which means are approaching, which means that we have, midterms have come. We've got exams and studies and all that sort of thing. Football is here, walking around the quad in cooler weather, but it also means flu season. So we'll be talking about that today and talking about some tips and giving some advice on that. Today I'm joined by our medical director here at McKinley Health Center, Dr. Robert Woodward. As I said, he is the medical director here, but he was also a staff physician for numerous years before that, so he has a lot of experience being on this campus and with the student body. Dr. Woodward, thanks for being here.
Morning, Matt. Thanks for inviting me. Thank you.
So somehow it's already November. I think we all feel that a little bit. I'm still getting used to, I was barely getting used to writing October on my dates, let alone now in November. And it seems like days just pass quicker and quicker. And because of that, as the semester rolls on, it's easy to let certain things fall through the cracks as you're getting busier and getting more involved in some things. And unfortunately, one of the things that most commonly gets ignored or pushed down the priority list is our health. As college students, very, very busy, have a lot of things going on, and often that self-care tends to fall to the wayside. And one of those things that might have been forgotten as that falls through the cracks is getting a flu shot. And once again, McKinley will be offering flu vaccines. Actually, we are currently offering flu vaccines free of charge to students, faculty, and staff. So let's start with the basic question of why get the flu vaccine?
Well, influenza is out there. It's just now starting to enter our community. This is actually a little earlier than normal. We've heard from Australia that the flu this year is going to be a little bit meaner and nastier than it has in past years. And thus, it's going to be important not only to protect your own health, but the health of your family and friends and everyone you encounter around you. So consequently, thinking about the flu shot and thinking about it earlier than later is going to be very, very important.
And we've had discussions throughout the building for a few weeks now that one of the reasons that there's concern about this flu season is because we've had mild, I don't want to say mild seasons, but we've seen less flu in the last couple of years, but there were some extenuating circumstances that came into that.
Yes, actually, for good reasons. We were working through COVID with 6 feet social distancing, masking wherever we went, lots of good hand hygiene. And we've kind of gotten away from that this year. The COVID seems to have not affected people as much as in past viruses, and people are starting to let their guard down. Unfortunately, you can't let your guard down for flu. And flu season is from November 1st through April 1st. It starts out in November, but it really picks up bad in January and February on a typical year. This year, we're anticipating everything kicking in about a month earlier. And that's one thing I don't think anybody on this campus wants to have is the flu and be knocked out for 7 to 10 days right before or right during finals.
And so if they do get the flu shot right now, it will cover through that January period.
It takes 2 to 3 weeks to build up your good immunity from the flu shot, but then it's good for 6 to 8 months.
Does one of the questions that I hear a lot is it the same flu shot every year?
No, it's not. They look at the flu viruses that are going on throughout the world, and they look at the 4 most common ones. 2 A's and 2 B's are typically used to create the flu shot. And this year, the 4 varieties for flu A is Victoria and Darwin, and for B, it's Austria and Punkert. So those aren't always the exact same ones they use year after year, but they do analyze it each year and try to make adjustments.
So if somebody wants to, let's jump to, before we get to some of the more questions about the vaccine itself, if somebody just wants to come get it at McKinley, what's the process? Do they have to sign up? Do they have to get an appointment? Do they have to, fill out anything ahead of time? What do they need? What do they need when they come here? What's that whole process like?
If you're coming for an appointment for another reason, you can simply ask your provider if you can get a flu shot on the floors while you're here. Otherwise, you can simply walk in the front door with your iCard, and if you so desire to have a family friend member come with you to hold your hand. But you just need to simply check in at our health resource desk. We have a flu clinic in our West 1 lobby that's available to you, and we can take care of it right then and there.
Does it matter which arm you get it in?
Yes and no. Some people react really well to the vaccine. And what I mean by that is your arm might get a little sore to it. So if you're a right-hand dominant individual and you got a lot of typing going on or something like that, you might want to request to have it in your left arm, or vice versa. But it's really mostly just a temporary thing.
Just a little bit of muscle soreness is
A little
usually.
muscle soreness, yeah.
So, so really it's a very easy process. It's really a rather quick process. Myself, when I got it, took me about 5 minutes to fill out the little bit of paperwork at the beginning, go in and get the shot, and then be on my way. So it really is not, as far as that's concerned, it's very little inconvenience on that. There are some outreaches that are happening on campus. If you go to McKinley's website and look, there's a few more left here in the season, but you can again come to McKinley and get that taken care of. One of the questions we always get, everybody always asks or has concerns about, is that if they get the shot, they're going to get the flu anyway. Well, I got it once before and I got the flu anyway, so it's not effective. What would you want to say to somebody who has those questions?
Well, first of all, it's a two-part question. The first question is do you get the flu from the flu shot? Which is no, you don't. But if you have a really strong, healthy immune system, you're going to feel a little bit off for 24 to 48 hours. You might feel a little muscle soreness, body aches, maybe a little low-grade fever, but that's good. That actually means your immune system is kicking in to create the antibodies from the flu. The second part of the question really gets into is, can you still get the flu? And the answer is yes. You can always still get the flu because there's 4 varieties that we're trying to predict, but we don't always predict them exactly correct. But the important thing is that you can actually minimize the length of time you're sick and minimize the symptoms that you have by getting the flu shot. And more importantly, you're also protecting those people around you that might be elderly, family members, people you're going to see over holidays and breaks, and you're going to minimize their protection. Ultimately, the goal for McKinley Health Center and U of I is to get 1/3 of the entire student population immunized. And that works out to be about 14 to 16,000. What that does is that creates a herd immunity. So even if one person gets it, if they have 3 people around them that are protected from the flu vaccine, it's not going to spread. So the whole idea here is we can protect everybody at large by taking that shot and protecting ourselves as well as our family.
Are there any concerns with someone who's taking who has allergies or is taking any medication to getting the shot concurrently? Is there high, somebody's at high risk for something, they shouldn't get the shot? Is there any of those concerns for our student population?
Well, let's start with the people that should get the shot. So if you have lung disease such as asthma or diabetes, or you're immunocompromised such as with HIV, those are the kind of people that should be getting the vaccine to protect them from the illness, because the illness could be worse than for a normal person. If you have an egg allergy, you do not want to get our vaccine. There are egg-free vaccines out there and available out there in the community, as well as if you don't like shots, there is a nasal spray vaccine that you can get, but McKinley doesn't offer that. But you can look into the community at the different clinics and see what would be available there. If you are on immunosuppressive medicines for say lupus or rheumatoid arthritis or something like that, you want to talk to your provider, your rheumatologist or your specialist that you work with, and speak to them first about when and where you should be getting your flu vaccine.
So if someone who does not have a specialist but has some questions, is there anyone particular or any resource that you would say, hey, if you want to know more, this is a good place to go?
Reliable medical places like the CDC website is probably the number one place I would go. I also recommend any website from like Cleveland Clinic or Mayo. McKinley Health Center has some information on our sites, and you can always call our 24-hour nurse, dial a nurse line.
Let's shift gears just a little bit. We've talked a lot about the vaccine, the reasons to get it, the process behind it, that sort of thing. But let's say whether you have the vaccine or not, you get the flu this coming season. What are some of the symptoms of the flu? What are things that you should look out for and say, hey, this could be what this is?
Well, the first thing you're going to look for in a typical flu situation, you're going to look for fever. So it's important to have available to you a thermometer of some kind that actually works and is reliable. Those are available at our HRCs, at the Student Union, and at the front door McKinley Health Center. Checking your temperature, seeing if you have a temperature over 100.4. But usually the flu would have a higher temperature of 102, 103. The other thing I always ask is if a person has some really harsh nonstop coughing. The influenza virus works predominantly on the lungs. Other symptoms which are not very specific are body aches, muscle aches, joint aches. Chills and sweats come right along with having a fever. So if you're taking medication for a fever and trying to keep it down, you would want to try for either Tylenol or Advil at the appropriate intervals on your bottle and try to bring your temperature down below 101. Low-grade fevers are actually beneficial when you have the flu because they help burn up the virus. So you don't want to totally wipe out your fever, but you don't want to be miserable either.
Are there other treatments for the flu if you have it? I know there's been times where there's been a shortage of certain things like Theraflu and things like that. Are there other things along with trying to keep the fever down that you would want to focus on if you are having those symptoms?
Well, things that are easy for any student to pick up is over-the-counter medicine. So if you have a cough, Robitussin DM is a brand name of over-the-counter cough syrup. The DM ingredient is the most important one because that is the cough suppressant. Robitussin is guanfacine, which is just basically Mucinex. That's a popular trade name for something that will break up mucus. So that will help you with your symptoms. If you have a sore throat, throat lozenges, cough drops, hard candy, saltwater gargles, those kinds of things are good for that. Body aches, I'm a little more in favor of Advil or ibuprofen for that because I think it really works better on the inflammation of the muscles. If your throat is really sore, there's going to be inflammation there. The only problem with ibuprofen is that it can irritate your stomach. So if you're not drinking or eating a whole lot, it can irritate your stomach, in which case you may want to take a Tylenol for that. For those people that are at risk of having serious disease, such as asthmatics and diabetics, there is medication out there that is available by prescription. One example is called Tamiflu. You do have to be seen within 48 to 72 hours at the onset of the disease for it to actually work at all. So if you come in earlier and you have those other comorbid illnesses, that is a question to ask your provider if you're a candidate for those medicines. If you come in after that, the medications won't have any effect on you.
And as you said before, a good starting point, if you're not sure, is the Dial Nurse, the chatbot on our website. Those are good places to start with questions and can get you directed to the proper answers on that. So if you were to give one quick pitch on why to get the vaccine this semester, we've gone over it a lot, but if you're giving one quick sentence for it, why a student should get the flu vaccine, what are your thoughts on that?
My thought is that you want to be well to excel. And no one could really afford in this time and age of being out for a full week, whether it's for work or for academics. You really want to keep trucking along and keep on your pathway to be successful, and you don't want to be derailed for a week. And you want to keep everybody around you healthy and safe, especially with 2 holidays coming up.
Dr. Woodward, I really appreciate you taking the time and just sitting down and chatting with us today. I know you're very busy around here, so I really appreciate it.
No problem, Matt. Glad to help.
As the semester rolls on, we are headed towards finals, but we are also in the flu season and heading towards the peak of the flu season. And so McKinley does offer the vaccine. A reminder, it is for students. You can get it staff if you're here. It is free. We do not charge. There's no copay. That's all taken care of. All you need to do is come in with your iCard, and then we'll get you taken care of. But like Dr. Woodward has said, we want you to be well to excel. We want to keep you on that. And if you have questions, reach out to Healthy Illini, reach out to McKinley, call the Dial Nurse, contact the chat bot. We're here to help you, and we want to keep you as healthy as possible as you're looking forward to your studies and your future. I want to thank you for joining us today. You are on a personal journey no matter where you are in it. You're important and you matter. Your health and wellness are important and matter, and we are here to keep you well to excel. So go have a great week, Illini. Let us know how you're doing, and we'll catch you next time on Healthy Illini.